I'm going to really whiz through my remarks, and that's going to be very hard because my job is to formally introduce Cynda. You've already heard a lot about her, and I will just echo the wonderful things that you have heard. There's a phrase that people who know me know I use a lot, which is something can be happy-making, or unhappy-making, as the case may be. And so this is a very happy-making event. This is an extraordinarily happy-making event for all of us, certainly for those of us who are gifted enough to have Cynda as a colleague. So the bare bones, Cynda is a professor of nursing with a joint appointment in the Johns Hopkins School of Medicine in the Department of Pediatrics. In addition to being a distinguished member of the nursing faculty, she was a founding member and is a core faculty member of the Berman Institute of Bioethics, and she co-chairs the Hopkins Hospital Ethics Consultation Service, which is to say she co-chairs the Hospital Ethics Committee. She has had many roles and continues to have many roles at this institution, some of which have already been mentioned. She is a pediatric clinical nurse specialist with her training there from the Medical University of South Carolina. She received a doctorate in nursing from Catholic University, where she was early days in a concentration in bioethics, very few people in her company at that point. Dr. Rushton has also been the recipient of two very coveted postdoctoral fellowships, a Robert Wood Johnson Nurse Executive Fellowship, and a Kornfeld Foundation Fellowship in the End-of-Life Ethics and Palliative Care. She is an extraordinary leader in nursing ethics. Her seminal work on nurse suffering and moral distress was selected for inclusion as an iconic example of the best of nursing ethics in the U.S. Nursing Ethics History Project. She's provided leadership for numerous nursing and ethics interdisciplinary organizations, too many to name. In addition to her scholarship on moral distress and suffering of clinicians, she is also focused on ethical issues in family-centered care, pediatric palliative care, advanced care planning for children, and she is a pioneer in exploring the conceptual foundations of clinical ethics, the concepts of integrity, respect, trust, and compassion. It really is important to underscore that Cynda is a global leader in bioethics and in nursing, not only professionally but humanly. I just learned that she has been asked by the People-to-People Ambassadors Program as an example to lead a designation to Cuba, now that Cuba is a little bit more opened up. In October, focusing on ethical challenges in healthcare, Cuba is going to get now added to the long list. She has led similar delegations to China, to Tibet, and to South Africa. On a professional level, one concrete example of her global impact, let me just mention a specific project from Cynda's experience. With her colleague, Dr. Gail Geller, she has developed an international collaboration to improve the lives of children affected by life-threatening neuromuscular diseases, and a related project focused on the ethical issues faced by neuromuscular clinicians, children, and their families. In 2009, she and Dr. Geller, together with two other Berman Institute School of Medicine colleagues, Dr. Mary Catherine Beach and Dr. Carlton Haywood, received a $1 million grant from the NIH and additional support from the Yarkos Foundation to extend their work in improving the lives of young people with neuromuscular disorders and sickle cell disease by integrating the principles of palliative care and the core principles of clinical ethics into practice, using an innovative educational intervention. And I just have to say this because it's really quite remarkable. In addition to standard scholarship, they developed 13 award-winning documentary films based on interviews with patients, families, and clinicians. They compiled this into an interprofessional curriculum, which has now been spread, disseminated around the world. It's a pretty extraordinary thing. If there's one general theme that I would say characterizes Cynda, it's passion, and it's the fostering of resilience among caregivers, but also among patients and families in their attempts to cope with and, where possible, overcome suffering. Cynda understands that while we cannot always cure, we can always heal. Whenever I think of Cynda, I see her at the very center of the clinical relationship, the very heart of what it means to be respectful and compassionate. In the finest tradition of nursing, she is an angel in the whirlwind. Please join me in congratulating and welcoming Dr. Cynda Rushton, the inaugural Anne and George L. Bunting Professor in Clinical Ethics.
Thank you so much. President Daniels, Dean Hill, Dr. Faden, Mr. Pinkard, and particularly Ann and George Bunting. I am so deeply grateful and honored to be named the inaugural chair of the Ann and George Bunting Professor in Clinical Ethics. As you have heard before me, Ann and George Bunting are really remarkable people. And it's really their vision, their generosity, and their clarity that undergirds this professorship. It is really a humbling thing to carry forward your name in my work. And I am so grateful for the opportunity to do that. So you've heard that, as far as we know, this is the first endowed professorship that brings together nursing and clinical ethics. So I stand here really on the shoulders of some incredible nurse ethicists who really were the pioneers of being able to help shape the territory that is really defined by where people who are suffering with either mental, physical, or spiritual maladies meet clinicians, doctors and nurses and social workers and chaplains and all the other members of the team at a time when they are most vulnerable and at a time when they're faced often with the ambiguities of treatment, of palliation, of recovery, and sometimes even death, in a healthcare system that is full of uncertainty and complexity, and many would argue is more beleaguered than ever before in our history. So this professorship will enable me to focus on the issues that are really important to all of us, in particular in bioethics. Clearly, there's no better place in the world to do this work, combining nursing and bioethics, than here at Hopkins. The Berman Institute, the School of Nursing, and of course the Johns Hopkins Hospital, which I have a very strong affinity for being able to maintain my connection there. Hopkins is known worldwide for its innovation, excellence, leadership, and the willingness to reinvent itself over and over again to meet contemporary challenges. The School of Nursing under Dean Hill's leadership and the Bioethics Institute with Ruth at the helm are already jewels in the Hopkins crown. And now we have an opportunity to add to that brilliance, and I am so thrilled to be a part of that. Some of you might be wondering what is clinical ethics and what unique contribution might nurses make to that. So I wanted to just take a minute and to share a bit of how I think about clinical ethics. For me, clinical ethics encompasses the ethics of doing and the ethics of being. The ethics of doing is probably the more familiar aspect of ethics, which involves the identification, analysis, and resolution of ethical problems that arise in the care of patients and families and with clinicians who are caring for them, in organizations where care is delivered, and in the context of healthcare and our society. It has both an individual and an organizational dimension to it, and both of them are really foundational for clinical care. Embedded in clinical ethics is the public promise that clinicians make to uphold their ethical commitments to the people that they serve through their codes of ethics. In addition to that, I would suggest that clinical ethics also encompasses the ethics of being. Our character, our intentions, our behaviors, and our values are embodied in the moment-to-moment interactions that transpire between patients and families and clinicians and among members of the interprofessional team. The space of being is what connects us to our humanity, our strengths, our vulnerabilities, our fears, our hopes, and it also connects us to the reality of confronting the limits of our knowledge, control, and our ability to predict the future. Our capacity to be fully present to ourselves and to be able to deeply connect to the essence of others is foundational for ethical discernment, wise choice, and courageous action. His Holiness the Dalai Lama says, real care for the sick does not begin with costly procedures, but with the simple gifts of affection, love, and concern. You might be wondering how those values connect to ethics. It is precisely those relational elements in the human exchange in healthcare that are as important, or arguably more important, than our scientific knowledge and our clinical expertise. It's really these two elements, being and doing, that are essential for good clinical care. They are not separate from one another. They are inextricably woven together, perhaps knitted together, in order to provide ethically grounded care. Arguably, ethics permeates everything that we are, what we do, and how we do it. You've heard a lot about collaboration and interprofessional practice, and clinical ethics is a wonderful example of those intentions. It is absolutely essential that the voice of nursing be a part of this dialogue. And without it, the solutions that we design are likely to be inadequate. The 3.1 million nurses in the United States represent the largest segment of our healthcare workforce, but it's not our sheer numbers alone that justify our being at the table. We've heard that the public, and it's actually the 13 out of the last 14 years, that nurses have been voted the most ethical and honest profession in America based on the Gallup survey. The public's trust in our integrity as nurses is a profound responsibility, and it's also an opportunity for nurses to be able to recognize, respond to, and to lead in solving ethical questions in whatever diverse practice they are practicing in the hospital, in the clinic, in communities, in organizations in the United States and around the world. So designing solutions to these problems really is going to require a new paradigm, new tools and skills to address these contemporary issues. There are many that we could focus on, but I want to just highlight 5 that I think might be a part of our agenda going forward. The first is, how do we engage a new conversation among people in need of health care about how to balance patient-family preferences, their choices, and expectations with the very real fiscal constraints that we face. This will necessarily mean that we address issues like futility and access to care and fair allocation of health care resources. Secondly, how do we balance quality and safety with efficiency? Quality is our commitment to do good for our patients, and safety is our commitment to do no harm to them. These are often at odds with our bottom line, and it challenges us to ask, are these the values that should be driving our healthcare system? Third, how do we cultivate respect, dignity, trust, and compassion in a relationally depleted healthcare system, where our citizens are more diverse than ever before? How do we learn to transcend fear and despair and accept the reality of aging, illness, disability, and death? And with that, to address the myriad ethical questions that arise for people living with life-threatening conditions and those who are dying. And finally, how do we address a growing concern about the impact of moral distress and threats to integrity on the recruitment and sustainability of our clinical workforce, particularly nurses? Alongside all of these are questions of policies, laws, and regulations that will have a profound impact on how all clinicians will deliver care in the 21st century. So for a moment, I'd like you to imagine what it might be like if we were successful. A healthcare system where the integrity of all people, those living with illness, disability, despair, and suffering, and the clinicians who care for them, are able to navigate that often frightening and uncertain territory with authenticity, dignity, respect, and integrity, where their moment-to-moment interactions are punctuated by deep connections to their purpose and meaning in life, and where hard decisions are grounded in values and principles that are embodied in every decision, in every spoken and unspoken conversation, and in moment-to-moment behaviors, where frustration and despair and moral outrage is transformed into principled, compassionate action. We are at a critical juncture in healthcare, a time when we are called to consider what values will drive our decisions. What kind of world do we want to create? And how will we engage the complexity and the uncertainty with integrity and courage? So as you've heard, one important element of this transformation is to make sure all the voices are present in that dialogue. And clearly nurses must be a part of that. Nursing leadership is absolutely necessary, and this professorship is really groundbreaking in its support of supporting nurses and strengthening them to be a part of this important dialogue. It's also a leverage point to reconsider what the values ought to be of the profession of nursing. How do we build on our strong foundation and expand it to meet 21st century challenges? There's a really urgent need to reground our profession in their foundational values so that we can create an educational system and a practice environment where ethics is no longer the add-on, but is fully integrated into moment-to-moment decisions, actions, and priorities. So I look out at all of you. There are so many people who have been a part of my journey in the School of Nursing, in the Bioethics Institute, the support from Martha and Marie Nolan for the opportunity to teach some of the most incredible students that you can imagine. You know, it's always sort of interesting. They think we're teaching them, and often they're actually teaching us. I have learned a lot from our students. Being able to have colleagues in the Bioethics Institute, people like Gail Geller and Joe Carese and so many others who have added to my scholarship and challenged me to think differently about my work. Mentors like Suzanne Feedham and Martha Curley and many others who are here who have been alongside me in this journey to really serve. It's incredible to think about all of those. And certainly, the reason I got to Hopkins was because of a nursing colleague, Carol Long, who came to DC to find me, to be her mentor. And afterward, she said, "You need to come to Hopkins." And I thought, okay, that sounds like an interesting idea. So I came, and actually, Lisa Pfeiffer, who was the director of nursing, and George Stover embraced the idea that we would create an educational program focusing on clinical ethics. And then through that work, we worked together to create the Harriet Lane Compassionate Care Program with our beloved Henry Seidel, Nancy Hutton, and so many others. But the two most important people are sitting in the second row. They're the reason that this all makes sense in my world. My beautiful daughters, Hillary and Callie, keep me grounded in what matters and really are the inspiration for all that I do. So, President Daniels, Martha, and Ruth, I am dedicated to using this incredible gift and the platform of this professorship to contribute to the legacy and the leadership and generosity of Anne and George Bunting, and to serve the university and the School of Nursing and the Bioethics Institute with my highest capacity. I think that aligning our expertise and our diverse and wise colleagues across the university gives us an unprecedented opportunity to create a full spectrum response that synergizes clinical ethics with the ethics of science, the ethics of public health, and the service to the people in need of our care. Together, we have the ability to do great things, and in ways that truly set us apart as leaders in the field. I would say we are the ones we've been waiting for, and now is the time to stand forward. I want to end with the words of Peter Elyard. The future is not some place we are going to, but one we are creating. The paths to it are not found, but made. And the activity of making them changes both the maker and the destination. I look forward to our journey together into the future to create a healthcare system that actually embodies the values that we aspire to. Thank you very much.